If you want to know about health and have health concerns, then subscribe to my channel and hit the bell icon. You'll be notified about all upcoming videos.
Hello everyone, how are you today? I am Dr. Paramjeet and you're watching Dr.Education. Welcome back to my channel. As you know, I make videos about health and healthcare topics, and today we are going to talk about muscle cramps. All our videos are directly referenced from US National Medical Library, so you can trust the information. That's now, and let's start with muscle cramps. Muscle cramps are sudden involuntary contractions. You can also call them spasms, and this can happen in one or more of your muscles, and this is very common, often occurs after exercise, right, after any kind of workout activity. And some people will get more muscle cramps, especially in the legs, which is also called as leg cramps, which happens mostly. They might have it at night, and they can be painful also, and they may have a few seconds, right? They may have it for few seconds to few minutes, right? You can have a cramp in any muscle, but it most often happens in the thigh, in feet. It can happen in your hands, arms, abdomen, or area along the rib cage. That is also very common, right? Then what causes muscle cramps, right? It is caused because of many things. Number one reason is straining, overuse of a muscle. That is the number one reason. And other reasons are compression of nerves, problems like spinal cord injury or pinched nerve in the neck or the back. Then the second most common reason is dehydration or low levels of electrolytes like magnesium, potassium, or calcium. So if you have electrolyte deficiency, that happens in dehydration. That is very good reason if you drink less water. Then if not enough blood is getting to your muscles because of any reason, right? If you have less hemoglobin or any other cause, if you don't have enough blood supply to your muscles, so calcium deficiency, magnesium, potassium deficiency, dehydration, overuse, straining, right? Then certain medicines, or even like people who are on dialysis, they might have these kind of deficiencies. Pregnancy will increase the demand of electrolytes and can have these muscle cramps, very common. So this is the basic reason of all these muscle cramps which you are getting. There is no more reason, right? So who are at risks, right? Who are at risk for these kind of problems? Obviously anyone can have muscle cramps, but people who are elderly, people who are overweight, people who are athletes, exercise too much, don't exercise at all, these two kind of categories, they have this problem. Pregnant women have a problem. Then people who have certain medicines like nerve disorder, neural problem medicines, or even thyroid medications can actually have this problem, right? These kind of muscle cramps. So what should you do? Should you actually go to a doctor? No. Only if the muscle cramp is very severe, does not go away, or happening very frequently, right? Or they last a very, very long time, or they are accompanied by swelling or redness or the feeling of warmth on that area, then you need to go to a doctor. Or if there is a muscle weakness, right? You cannot move the arm, you cannot move the limb. That is also a problem, right? Then what are the treatment for muscle cramps? That is the most important questions. So obviously, usually no treatment is needed for any kind of muscle cramps, but what you can do to get relief, number one thing is stretching or gently massaging the muscle does the trick many times. You can also apply heat when the muscle is tight, right? If the muscle is tight, you can apply heat, and if the muscle is sore, if it is paining, then you apply ice. That's the concept we need to understand. Heat when muscle is tight, sore, then muscle ice, right? You need to get more fluids. You need to drink a lot of fluids and correct your dehydration. If any other medical reason is there for your cramps, you need to treat that medical reason with the help of your doctors. And if there is a medicine which is causing the cramps, you can get it changed by your doctor. So the most important question, can you prevent muscle cramps? Yes, you can. You need to stretch your muscles regularly, especially after and before exercise, right? If you get leg cramps at night, then stretch your leg muscles before going to bed. Then drink plenty of water on liquids, right? At least 3 liters, even in winters. And if you do intense exercise or in heat, or if you drink sports drink, then sports drink can actually help you replenish your electrolytes, right? Don't go for sugary sport drink. Basically electrolytes needs to be there. So this is all about muscle cramps. I hope you like the video. Give me a big thumbs up, share this video, and I'll see you next time with something more important. Take care. Good night. See you.